Amanda from StraightSmile Solutions, and today we're going to be talking about impacted canines. And I've had a lot of experience with impacted canine cases. Some went really well, some didn't go well. In general, the ones that tend to go well are the ones where the patients are very, very, very young, like less than age 12. Usually you have really good success. The older they get, the less success. Of course, it's also, if you've checked out the My Phase 1 Smile Index, which we created, it is going to be available. It is available on our website. It's StraightSmileSolutions.com. You can get a copy of it. I believe the fee is about $20 per download, or it's free with our membership programs. But basically, it really comes down to, if you can see here, this is recent. This is 2020, age 11. Okay. So you can see you're looking at the angulation. So this tooth is definitely, obviously we want it vertical, right? So I'm going to put this at almost 40 degrees angled, and then also how overlapped is it with the central and lateral incisor? And this one is quite overlapped, right? It means almost half on the central. So this one, has maybe a 50% chance of success, assuming it's palatal. So I don't give it an awful lot of success, but in any case, this good thing about this case is that it was recognized really, really young. This is back in 2015. The patient was 6. So you can see here on this side, this is what you expect to see, right? Central, lateral, canine, parallel, right? High. Here you have central, lateral is doing weird things, canine is doing weird things. Something is clearly going on here. Even if you take panos at age 5, 6, 7, you want to be looking for symmetry. And this is what you want to see. This is what you don't want to see. This was already a bit of a red flag. And then, of course, this is what actually ended up happening. So just to give you some 3D vantage point. So what's happening here is actually the crown. This is palatal. We had a couple of CBCTs done over the past couple of years. So the crown is actually sitting in between the roots of the 1 and the 2 here. And so expansion was done upper and lower to provide space. You can see there's a lot of crowding and underdeveloped arches here, right? Then phase 1 was done with aligners to bring these together. Spaces were closed, but we were unable to root correct this because this crown was in the way. So there was no way to upright this anymore without getting into an actual exposure. Normally I would say do the exposure once all the teeth are in, you're ready for comprehensive, but in this case we really didn't have a choice. So we had to get started. So this is the exposure picture. This is day 2 after the exposure. Full flap was done. You can see the sutures here in this whole area. The crown is right here. You can actually see it right here, and then the root goes a little more distal. There was a lot of questions whether or not this tooth was transposed, but actually the CBCT says it's not. So theoretically, if we were to move the crown, so right now we have to think of it in three planes of space, right? We can't just move the crown this way because we'll hit this root, right? So we have to move the crown back, and the root's actually where it's supposed to be, and then over, and then forward. So we have to do it in 3 steps. 1, 2, 3, which is really tricky when you don't have x-ray vision, right? And it's not that great to take CBCTs all the time on a young patient. So hopefully we don't have to take any more. But that's the plan. Now, just to let you know, there's a gold chain. This is a suture, and back here there's a TAD, which we may or may not end up using, but just for kicks, we put one back there just so we could have some distal anchorage later to bring it forward. So in any case, that is what we've got going on here. I just kind of wanted to talk about the case with you because I'm going to be following this case over the next few years, and I'm going to be giving you guys progress. Hopefully we're having success. To add a layer of complexity onto this case, the patient, who I know well, does not want braces. And when I say does not want, refuses braces. Patient wants to do this with aligners. So hence the TAD. It's getting a little more interesting. I'm not saying we might not put a bracket or maybe a TPA on or something like that with a hook, but patient does not want braces. Patient is a model, is an actress, very aesthetically oriented. It's not an option. So anyways, that's where we are, trying to save this tooth. I'm just gonna blog about my story. And for those of you who are interested in taking canine exposure cases, they can be very tricky. And just to tell you a little story, personal stories that I've had, I mean, for the most part, I've been pretty successful. The ones were especially older patients, older than age 20, that if I had a patient that was age 20 that looked like this, I wouldn't even bother. I would say no, thank you. It's the likelihood is 10%, 5%, 2% that we can pull this off. You know, not worth everyone's time and effort. I've done them before, and if it doesn't work, even if you had them sign a million consent forms saying the likelihood is 2%, if they go and appeal to the insurance, there's a chance you're gonna have to give them their money back. So it's just, I don't know. It's just it's not worth the effort, in my opinion, in an older patient. So catch these in your little patients and give it your best shot is all I can say. I mean, I want to save this patient from an implant. You wouldn't be able to get the implant till you're 18 or 19 anyways in a girl. Who wants to have a space or a flipper or have to wear an Essex all the time? You know, let's give it our best shot. So excited to blog about this case. I'll be telling you more soon. Thanks.